Environment for December 10th, 2024. It's 7:32 a.m. And Ms. McDonald, would you please call the roll?
Mayor Slanka.
Here.
Mr. Richmond. Ms. Sipsey. Ms. Cash.
Here.
Dr. Zollett. Ms. Lawley.
Here.
Mr. Bonnell.
Here.
Ms. Miller.
Here.
Thank you very much. And do we have any citizen comments to begin? Oh, sorry about that. Can we excuse, do we have a motion to excuse our members who are absent, please?
So move.
Second.
Thank you. Is there any discussion? And we'll go ahead and call the roll.
Mayor Slanka.
Yes.
Ms. Cash.
Yes.
Ms. Lawley.
Yes.
Mr. Bonnell.
Yes.
Ms. Miller.
Yes.
Okay, so now do we have any citizen comments? I don't see any. So then we will continue on the agenda to approve the minutes from November from last month. Do you have a motion to approve the minutes from November?
So moved.
Is there a second?
Second.
And is there any discussion? Okay, hearing and seeing none, we will move on to vote. Will you please call the roll?
Mayor Slanka.
Yes?
Ms. Cash.
Here.
Ms. Lawley.
Yes.
Mr. Bonnell.
Yes.
Ms. Miller.
Yes.
Okay, thank you very much. And we have the financial report to receive and file. Is that a motion as well?
Yes.
So is there a motion to receive and file the November financial report?
So move.
Thank you. Is there a second?
Second.
It's been properly moved and seconded. Is there any discussion?
Question, comments?
Hearing none. Okay, we'll proceed to vote. Ms. McDonald, please call the roll.
Mayor Slanka.
Yes.
Ms. Cash.
Yes.
Ms. Lawley.
Yes.
Mr. Bonnell.
Yes.
Ms. Miller.
Yes.
Okay, motion passes, thank you. So the next item on our agenda this morning is our education presentation from our Dr. Genowine.
Good morning, everyone. So December is HIV Awareness Month. So we're going to talk about human immunodeficiency virus. So HIV as a virus and as a disease entity was first officially described in about 1981. It actually is two separate species, HIV, cleverly named HIV-1 and HIV-2. The virus attacks our immune cells, particularly the destruction of our CD4 T cells that are crucial in our immunity. It is a single-stranded RNA retrovirus, so it's a single strand of RNA that infects the cell, and then once it's inside the cell, it actually replicates itself into a double-stranded DNA strand. That is then taken up into the nucleus of the cell and incorporated into our DNA inside that CD4 cell. So the problem with that is any defenses that we have can't see it inside the cell because it looks like our own DNA. And then the virus uses our system to then start replicating itself through appearing to be part of our DNA, and then sends out new particles to go out and infect new cells. This particular disease has a long incubation period, unlike a lot of viruses, which are fairly quick to act, 7 to 10 days. You know, people get symptoms and get sick and have a much shorter course. This is a long incubation period with a long chronic illness typically. Estimates are 1.7 million Americans have HIV in some form, and approximately 15% of those are unaware that they are HIV positive. And the interesting thing about those numbers is that they really haven't changed in about the last 5 years. So despite a lot of effort and population growth on both sides, you know, positive that should be lowering our numbers, but also growth that increases, and particularly with our IV drug epidemic that currently goes on, the number has remained fairly consistent. In the sad part too is that 15% has remained pretty constant through that all too. That despite all of our kind of awareness and trying to get testing to be much more widely available and widely used, it's still a pretty high percentage of people who don't know that they're infected. So this illness has an acute phase, a chronic phase, and then what's considered AIDS in the last phase. So the acute infection is when the virus is first introduced. It's about a 4-week, typically about a 4-week process. You may get mild viral syndrome, so some fevers, chills, muscle aches, headache, maybe loss of appetite, nausea, just kind of the typical mild viral symptoms, or you may be completely asymptomatic even. After that 4-week stage, during that 4-week stage, the viral count is rapidly growing inside of the individual. So they're quite contagious, they have a very high viral load, and it's probably the most infectious point in the disease. After that 4 weeks, things kind of start to settle down, the body starts to try to catch up, and they become asymptomatic. And that chronic infection, they're still contagious, they still can pass the virus along, but they pretty much are completely asymptomatic, and that stage can last anywhere from months to years if left untreated. And then if left untreated from there, as the virus continues to destroy those CD4 cells, the immune system falters, and it leads to AIDS, which we'll talk about here soon. So AIDS is acquired immunodeficiency syndrome. So it kind of gets its own category, because this is kind of what was originally discovered, was people coming into the medical system with very unusual illnesses. We didn't know what it was. It would be things like pneumocystis pneumoniae, which is a very rare pneumonia for people with typical immune systems. It was usually seen in people with chemotherapy or other genetic immune problems, very unusual cancers. So it was kind of first described as the first discovery of the illness as to why people had this immunodeficiency syndrome. It obviously attacks the immune system, as we said. The diagnosis of AIDS in particular, of being into that stage, is to have a CD4 cell count of less than 200 cells, or have had an opportunistic infection. So an opportunistic infection or cancer. So it would be that pneumocystis carinii, or certain fungal infections, or cancers such as certain rare lymphomas and Kaposi sarcoma, which is a cancer of the blood vessels. So to get diagnosed as the AIDS stage, you need one or the other of those two factors. And essentially, your cell-mediated immunity is lost. So you're susceptible to just about everything, and it's a very difficult disease at that point. Transmission of the HIV virus, it is considered a sexually transmitted infection. It's transmitted through bodily fluids, which include blood, seminal fluids, vaginal fluids, breast milk, but not saliva. That was a big scare early on. People were worried about all the possibilities. That's with a caveat, that's assuming there's no bleeding gums or an oral ulcer that would allow the virus into the saliva, but typical saliva is not considered infectious. The interesting point is that it is not transmittable if the viral load is low enough. So as best determinations are at this point, if you have a viral load of less than 50 copies per milliliter, it's considered undetectable, and that individual is not infectious. Sorry, I got a mistypo there. HIV-1 is 2 to 3 times more likely to transmit. It's more virulent and more contagious than HIV-2. And mother-to-fetus transmission is quite common, both during the pregnancy, during delivery, and then, of course, through breastfeeding. Risk behaviors are a big thing in transmission, which I think is on the next slide. Nope, a couple more slides. Anyway, so diagnosis is by a pretty simple test nowadays. It is a blood test. The ELISA testing is quick, it's fairly inexpensive, it's quite accurate. You still need a secondary test to confirm it, through PCR testing typically, but you can have up to a 6-month delay in turning positive, because it's actually looking for the antibody. So it's looking for your body's response to the virus. So there can be a delay. You could think you had an exposure, get tested a month later and be negative. That doesn't mean that you don't have virus in you. You have to retest again after the 6 months from your exposure time. Nowadays, testing is done as a screening. You know, it's a big part of public health, is trying to get anybody. Recommendations are to screen everybody in certain age groups at least once in their lifetime, but especially people who are in the higher risk categories. Also testing after a concerned exposure, and then of course if someone presents with some unusual infectious disease ailments, then you're going to go looking for, could they be HIV positive as well. Prevention, there's no vaccine. They've been looking for, decades now, and have been really struggling with finding anything good. So it really is about behavior modification for prevention. Condoms is the biggie. It's simple, it's effective, it's not 100% because there are still other ways, but it puts a big dent in the ability to spread the infection. Clean needles, not reusing needles, not sharing needles. Obviously that's in the IV drug world, and that's a very highly contagious situation. So providing for clean needles and not reuse is huge. These next three are newer defenses in the last 5 years or so. PrEP is pre-exposure prophylaxis, so there is actually medication, a dual medication that's taken daily by people who consider themselves at higher risk for exposure. They can take the daily medication, and then if they are exposed, it greatly reduces the risk of transmission. In sexual exposure, it reduces the risk of contracting the virus by 99% when it's taken consistently. In HIV drug use, it reduces contracting the virus by 74%. So it's a huge positive in prevention. But it's expensive. They have to seek medical treatment beforehand and be on it and take it consistently. TASP is treatment as prevention. So someone who is already HIV positive, being on treatment, getting that viral load down to undetectable is prevention in itself. So they're then not able to spread it to other people, whether that's through sexual contact or IV drug or whatever. But again, it's expensive. It takes seeking medical care and taking that medication very regularly. Any kind of misses on those dosings lead to rapid viral increases and back to being contagious again. PEP is post-exposure prophylaxis. Still quite effective, not as effective as PrEP, but still quite good. And that is that if you find yourself in an unexpected exposure, that you can then seek medical care within 72 hours and get on antiretroviral medications for 4 weeks, and that again greatly reduces the risk of contracting the virus. So medication-wise, there's quite a good treatment options for prevention, with the caveats being that they're not available to everyone easily, very expensive, and really have to be taken religiously. Prenatal care is obviously huge, so if someone who's HIV positive or even is a high-risk category gets pregnant, seeking out prenatal care, getting tested, finding out if they're positive, getting them actually on retroviral medications during the pregnancy, again, greatly diminishes transferring the virus to the fetus as well. Circumcision is an interesting one. Males getting circumcised reduces the incidence of that individual contracting the HIV virus. Treatment, there is no cure. Once you have this disease, it is a lifelong illness. It is now considered to be more of a chronic condition, as most patients who get treatment do not progress on to AIDS and live quite long, healthy lives. We've got people now in multiple decades of being on some version of the antiretrovirals and doing extremely well. One of the keys is to begin as early as possible to get your best odds of response and becoming undetectable viral loads with earlier treatment. It is antiretroviral therapy medications. There are 7 different classes that fall under the antiretroviral therapy. Multi-drug regimens are what is used to reduce the chance of resistance, and it is using at least 2 different categories and 3 different drugs. The early agents were moderately effective, but you were taking 3 different drugs separately. Some of them were twice a day, some of them were 3 and 4 times a day, and some of them were as often as 5 times a day. So people were taking drugs a pill every 1 to 2 hours, just repeatedly all throughout the day. Very complicated course, very easy to forget your doses, very difficult to be consistent with it, which is what was needed to be effective. They also had a lot of side effects, and they just weren't the greatest drugs. But they in turn led to the newer agents, which now are a combination tablet. So you have those 3 drugs oftentimes in one pill. It's taken 2 or 3 times a day, much simpler to take, much more effective, and much better tolerated, but very expensive. So treatment nowadays is much better, and it really, again, to reiterate, has become more of a chronic condition, a lifelong illness, rather than a progression to AIDS and death. And the key for treatment is really, at this point, at this stage of the disease, or our knowledge of it, the key is to get to a viral load that's undetectable, because then it's not contagious. If you can get that individual to undetectable, they won't progress into any further stages, they won't spread it to others, and we hopefully can reduce that transmission and rates of it until we find a better cure or prevention. Any questions?
Yeah. Anybody have any questions?
I do.
Yes.
Do we know what accounts to 15% of people not knowing? Is it just they don't want to test, or?
Or they don't think that they
don't
are
think
high
that they
risk. I mean,
are.
a good
Okay.
example Jackie always gives is, in the earlier days when a lot was misunderstood or not known, but, you know, small data was coming out, it was called the 4-H disease, because it was considered homosexuals, heroin users, Haitians, and hemophiliacs. So you had people receiving lots of blood transfusions, which again through screening has been almost eliminated, and solid organs. But the term heterosexuals, there's the thing in public health that, you know, a lot of men don't necessarily view themselves as homosexual, that they may be more bisexual or just this occasional thing over here, but I'm really a heterosexual. So it's become more about men having sex with men, is a more common term nowadays. So it's trying to open that mind up, that people who may not think they're very at risk really have done risky behavior. Maybe it's just having sexual relations with a prostitute, or someone who is 2 degrees removed that you don't even know. So there are a lot of people who don't think that they're in a high-risk category or have had any possible exposure, but have, and they're not getting tested. So that's kind of why, for the push of at least getting everybody tested once. I don't think that really serves a big purpose in finding the disease. I think it's getting everybody's mind open to, everybody needs tested. So why wouldn't I get tested? So once everybody, the social community is more accepting of, well, that's just part of my routine healthcare as I get tested
So
for
there's like a
HIV as a
stigma.
blood test.
Yeah, stigma.
Then we'd be testing annually or whatever, whenever I get my lipid tested, and I think that's when you can hone in on those
Yeah.
people who might be being missed.
Yeah, because I think even when you go to your family practitioner, you know, I go annually and I'm asked some very intense questions.
Yeah.
And that sometimes determines what kind of tests we're gonna do.
Yeah.
Right, so we also need to be answering things correctly and honestly.
Of course, of course. And again, I think that comes with terminology of trying to widen the patient's perception of, am I answering that question appropriately, consciously or subconsciously?
Yeah.
And, you know, a good example is hepatitis C. Just recently was introduced as a screening test that everyone should have at least once, again. And that's been a bigger push even at this point than HIV. So I think that, again, the healthcare system is kind of trying to nudge people in that direction,
Yeah.
but it's slow moving.
Yeah, because I was asked, I mean, full disclosure, do you want that as a test? Well, yeah.
Yeah.
Yeah, why wouldn't I? But there are people who.
You're already drawing my blood,
Right,
you know.
throw it down there, yeah, okay.
Why is it not just included then? Is it because nothing's included until you say yes?
Yeah,
Well, and part of it is insurance driven,
yeah.
so it has to be coded right, you know, as far as the insurance company wants to know why you're ordering that test. So there are definitely hurdles that come from our side as to how we do that to get it approved. So, you know, and then it becomes a stigma with, well, gee, if I say there's a possibility that they had a high-risk contact, well, then that goes into a medical chart. You know, and is that then held against them in some way, shape, or form, either in insurance or, you know, just somebody worrying that someone's gonna see their medical record or whatnot, so.
That's true. Is that a possibility of change in the future just because it is so important to have be checked, just in general, everybody being checked? Is that a change that could be coming? Or is anybody talking about that?
I think that's where it's being driven, but I don't think, as I'm sitting here now, there is no test out there that insurance lets us just do willy-nilly on everybody.
Interesting, since that is what kind of is wanted. at least from the presentations,
Yeah.
everybody should be getting checked, because you might just not know.
Yeah, and I think, you know, glucose and lipids, you can kind of skate by, I suppose, on some of that with being paid for. But I think it's gonna take, like insurance is now, a mandate that screening colonoscopy, screening mammograms have to be covered by insurance. It's gonna take probably, would have a mandate from the government on the insurance industry to say, these tests, these blood tests need to be paid for on a certain,
Annual.
certain period of time,
Mhm.
frequency, yeah.
Yeah.
Mhm.
Is that, do you think that's likely?
Oh, I think it will happen at some point, yes. I think it's probably more likely that the push will get more people coming in and asking for it and being more open with, you know, am I possibly at risk, and just going with that. It's probably the more likely scenario as time goes forward.
And then I had a couple questions also about, you said the incubation period is longer. Is that the 6 months period? Because it's 7 to 10 days was too short, correct? For the,
Yes, no, the incubation period is how long it takes the virus to grow in your body to then become infectious to others. So, you know, that's usually within a few days of a typical virus. This is more like a 2 to 4 week period.
okay,
That you're gonna be infectious
Gotcha.
to others.
got you, thank you. And you'd mentioned also that, the recommendation screenings are for certain age groups and then higher risk categories. So the higher risk categories are just highly, could you just,
The two biggest categories that are pushed the most are men having sex with men, people having, or in the sex work industry, and IV drug users.
okay. And then the age groups for screening?
I think it's 16 to 64, it's a pretty big age group.
Yep.
Yeah.
It's a lot. Okay. Any other questions for Dr. Gentleman? Thank you very much, that was very informative. All right, so the next item on our agenda today is new business. So it looks like we have no travel authorizations for this month. But then we do have the approval of ordinance 2024-04 for pay and benefits, and the approval of ordinance 2024-05-2025 for the health department budget.
Yes, for an emergency. Okay, as an emergency, I didn't put that on the agenda, but they both need to be read as an emergency since we're approving today.
Okay,
Sorry.
that's okay. And do we have, let me just find it really quickly, it's hard. Okay, so here's the first one. So we do have a motion to approve ordinance 2024-04, an ordinance establishing pay ranges and certain benefits for employee classifications in the Middletown Department of Health and Environment and declaring an emergency. Is there a motion?
So moved.
Is there a second?
Second.
It has been properly moved and seconded. Is there any discussion? Okay, hearing none, we will proceed to vote. Ms. McDonald, please call the roll.
Mayor Slanka?
Yes.
Ms. Cash?
Yes.
Ms. Lawley?
Yes.
Mr. Bonnell?
Yes.
Ms. Miller?
Yes.
It has passed. Thank you. The motion passes. And then I'm trying to find the second one here. Here it is. Okay. Thank you. Yeah. And then, do we have a motion to approve ordinance 2024-05, which is a regulation approving the proposed fiscal year 2025 operating budget for the Department of Health and Environment and declaring an emergency? Is there a motion?
So moved.
Is there a second? Thank you. It has been properly moved and seconded. Is there any discussion? Hearing none, we will proceed to vote. Ms. McDonald, please call the roll.
Mayor Slanka?
Yes.
Ms. Cash?
Yes.
Ms. Lawley?
Yes.
Mr. Bonnell?
Yes.
Ms. Miller?
Yes.
Thank you. The ayes have it, and the motion passes. Next item on our agenda are reports. We'll begin with the Health Commissioner.
Okay. Well, Jackie's report is in the packet, and if you have any questions regarding anything there, I will be more than happy to take it back to her. So her report is in the packet. I do want to mention that I attended the red carpet luncheon in Hamilton with Jackie. It was a panelist discussion. It's the first of its kind, I believe, in Hamilton, held by the Chamber. The 3 health commissioners were on the panel, healthcare providers, and it was basically talked about health and wellness and how business owners how they could, make a difference, in health and wellness within their businesses. Ruth attended. I want to thank Ruth for attending. Ruth, did you have any, comments about the luncheon?
No, it was interesting, yeah, yeah.
And it was a basic discussion, like, for some businesses, maybe, you can allow employees, it was how you can make it a little bit easier, what differences you can make and how you can, maybe you can implement walking programs for your employees. Maybe you can make it easier for employees to take off, to go to doctor's appointments and things of that nature. So it was real informative, and hopefully we can get, different businesses to get on board with that. We talked about the CHAW, which is the community health assessment, and what the 3 priorities were as well. So the community could be involved and know what the priorities are
That's nice.
with the CHAW. So hopefully it'll be an annual thing.
Were the
So-
chambers there, like Chambers of Commerce?
Yeah, well, the chamber and just different businesses throughout, Butler County.
Was it pretty well received?
It was, I thought it was, yes, yes.
Basic, the gist of it is healthy employees,
Healthy.
better businesses.
Yes. We're happier people, we just do better in general.
Yeah, and hopefully it'll be an annual thing, so, and get more people involved.
Yeah, I like that, because it can be very difficult to even just go to a doctor or
Mhm.
just stay home if you're not feeling well, right?
Mhm.
And you might not have gone to the doctor, but you know something's wrong, right? So that's a good conversation to at least begin. You said it's the first of its kind?
Yeah.
That's good.
And sometimes when you're new, you start work and you need to take off to go to the doctor, it's just having employees be receptive to make it easier for them to request off. And it was just a lot of, ways that business owners could be involved, or have, healthy luncheons and activities and
Fruit
different things
cups.
like that. Fruit cups, yes.
With the-
Lunch and learns, talking about how to be healthy as well. So it was just giving employees ideas, and they're not doing it. Right.
Very nice. Anything else for under Health Commissioner's report?
I think that's it. If you have any questions, let me know, and I'll get them back to Jackie.
Thank you very much. Next on our report, Medical Director.
Reportable illnesses for the month of November. We had 24 cases of chlamydia, 16 cases of gonorrhea, 6 cases of hepatitis C, 5 cases of pertussis, 2 cases of Candida auris, 1 Campylobacter, 1 E. coli with Shigella producing toxin, 1 aseptic meningitis, 1 Salmonella, 1 Streptococcal group A invasive, 1 Streptococcal pneumoniae invasive, and 1 syphilis.
Thank you. Any questions or comments for our medical directors? All right, thank you. Hearing none, we'll move on. Next report is our Director of Nursing.
So, as Dr. Denwine said, we had 5 cases of pertussis this past month. I'm sad to say we've had an additional 2 this month so far. But as you can see in the report, it's everywhere. Butler County themselves had 10, Hamilton had 3. In our READY group, which is our Regional Epidemiology and Disease Investigator group for the whole of Southwest of Ohio, we're all discussing the fact that it's here, it's spreading, it's in vaccinated children, it's in unvaccinated children. It's just, all of our cases were in children. We didn't have any adult cases reported. 2 now have been under a year old, so they're not fully vaccinated yet. Others are kind of getting close to that transition period of having their primaries and getting ready for their boosters. So they're kind of in that in-between age group, where their vaccine status is waning a little, is kind of a suspicion. I think 2 of them out of all of those have been linked by school, but not even the same class. And I, unfortunately, much like many of the communicable diseases, I don't always get in touch with the folks. So the information I get most of the times is from hospital records or doctor reports, or even the schools report to me. And they may not actually speak to me, but they have spoken to the school nurse, which is better than nothing. So we do attempt to reach out. Candida auris is still, the CRS is still something that we're seeing, mostly in folks that are coming to our hospital and getting screened and being found positive, but they don't actually reside in Middletown. They're residing out of the county. And let's see, workforce development grant. I think as I reported last month, we will not be receiving any more monies this month, or through the end of this year, because our billing cycles end at the same time as the end of the year. But we will be submitting claims in January for this previous quarter. We did receive notice finally from the state that we can submit a budget revision within our workforce development grant for the $50,000 to be used toward FAB accreditation efforts. So I am in the process of rewriting that budget and adding that line item in. So more to come with that on how we can use that money. It does have to be used specifically for accreditation purposes, which they have already said that we can prepay through the length of the grant for our annual fees that are required for our FAB accreditation. So that's a nice thing that we don't have to worry about if that's how we choose to use the money. So again, more to come on that one. The FEP grant, our preparedness grant, Public Health Emergency Preparedness Grant. They are in the process of issuing next year's grant documentation, which will go through Butler County, and then we will be a sub-grantee, like we always are, through them. So in the coming months, we should be getting a new contract for our FEP grant, though we are still obviously working through this current year. The FEP grant runs July through June, so halfway through the year, they put out the new proposal for the new upcoming year, so people can start planning and writing those contracts. But I think that should cover everything in the nursing realm.
Well, thank you so much. Any questions or comments? All right, thank you. Here now we'll move on to our environmental health director.
For the month of November, we received 3 sets of plans. One was a food service operation, 1 mobile, and 1 body art. We've mailed out second notices for our T21, which is our tobacco program. So, and I believe, do you know how many we've received?
About 30.
We've received about 30 back out of 70. So, moving a little slow with those as far as receiving. Sewage, we've received about 200 sewage operation and maintenance payments. We also mailed out our business license renewals for septic. And our body art licenses renewals, those have to be in also by the end of December. I've actually attended a meeting with Ohio Department of Health, and we're getting a new web-based program for inspections and payments. Right now we're using HealthSpace, but it's not totally web-based. This program will allow us to accept payments and do inspections for most of our programs. So that should take place in May. We're looking, so Amanda and the inspectors and I have been training, and we will continue to train as Ohio Department of Health gives us the training for the new web-based program. We also are getting a new Vital Stats program. Can you talk about that, Amanda?
We are getting a new Vital Stats program that is going live January 1st. It'll be nice because we can do statewide issuance for death certificates, whereas right now you can only go to the city or the county where the person actually died to get the death certificate. So it'll be statewide for that. Birth certificates stay the same, so it's still statewide for that. Should be nice once they get it going. I don't know, Jeff knows too. It's we still have some trainings coming up, so.
Looking forward to that.
All right.
So, and that's it for environmental health.
Well, wonderful. Thank you so much. Yes, go ahead.
That's it.
Oh, that's it. Any questions or comments? All right, seeing none, we will continue. So the next item on our agenda is board member open discussion. Anything that we need to bring up under open discussion?
Sally, I want to thank you. This is Sally's last meeting. And on behalf of Jackie, the board, and the health department, we appreciate your service and your years of service, and we appreciate you picking up where Dr. Patrick left off, so thank you.
Yeah,
We're gonna miss you. Thank you for,
I'm gonna miss it.
Oh.
Yeah, I am. It's been, I've done it a lot of years,
yes, yeah.
so I will miss it.
Well, thank you, and you can always visit us.
Citizen
7:30.
comments.
Yeah, citizen comments. Well, thank you very much. Thank you, that was very kind.
Thank you.
Any other comments or questions, open board member? One of the things I just, on the way here, listening to the radio, heard, and speaking about, the red carpet luncheon and health place initiatives in the workplace and things like that, just thinking about exercise. And, the program was about exercise and how we know it affects our heart, but also, or we know that it's been shown again now in mood and mind, but also the memory, like the mind itself, and how the next day after we have even just brisk walking or just dancing, like moving our bodies, how it improves our memory. And I just think that's nice to know that so much of our health is within our own control in certain ways, right? Even if we're not mobile, we can still move our arms and get moving to some music if possible, hopefully. But there are different ways we can do things, even if it's just breathing in structured ways and cognitive clear ways. So I just wanted to mention that. I thought that was very empowering and good to know.
Yeah, it's nice even if you could take 5, like I usually try to walk during lunch or take 10 to 15 minutes, and I see other ladies walking 10 and 2. So if you could get walking groups and things like that, that helps too, you know,
Yeah,
with your health.
because it doesn't have to be intense,
Intense.
really difficult, although that's also fun if you want to do that.
And it relieves stress
Yeah.
too, I think, you
Yeah.
know, so if you staring at a computer all day,
Yeah,
get
just
away and.
make sure we move our bodies.
Yeah, exactly.
Something else that's like also important, I know that heavy lifting for women especially is also very important because it's not gonna make us bulk up too much, but it's really important for our bones and things like that, but just thought I'd put it out there as well. All right, well, thank you for that. Any other comments or questions or for open discussion? All right, I guess I just wanna say have a wonderful holiday season and thank you so much for all of your hard work this year. And we will go on and adjourn at 8:09 a.m. And their next meeting is scheduled for January 8th, 2025 at 7:30 a.m. in this room. Thank you.